Ladies, admit it, we love our shoes. We have closets full of heels and platforms and wedges. And how many of you out there have worn shoes that hurt? And I mean really hurt, all for the sake of style. Well, the price of vanity could set you up for painful bunions and possible surgery. But doctors at OhioHealth know that common sense and the right shoes could save your feet from pain and surgery. High heels. Don't we love them? Yet stuffing our feet into shoes that don't fit and trying to balance on stacked heels really isn't doing our feet any good. A recent podiatry survey showed that 73% of women admit they have foot issues, ranging from bunions and corns to hammer toes. Bunions finally led Connie Nolder to seek help from Dr. Thomas Lee at the OhioHealth Westerville campus. An avid exerciser and runner, her bunions and hammer toe were interfering with her life, and Connie knew surgery was the answer.
Finally, the pain got bad enough where I just said, I've got to do this.
Connie says before surgery, she could only wear really wide shoes with no heel. Otherwise, she experienced pain. So Dr. Lee performed surgery to correct her bunion and hammer toe.
I'm definitely happy I did it, and Dr. Lee did a phenomenal job. And now I'm on the other end of it, 5.5 months out, and I'm working out, and I'm wearing normal shoes, and I feel great. And my foot looks so much better.
Still, the recovery is painful, and you need to stay off your feet.
First 2 weeks, the first week you're in a cast, and basically you're just on meds, and you really keep your foot elevated, and you can't do a lot the first week. After that, you become you have a boot on, and you become a little bit more mobile. But again, I had it on my right foot, so driving was difficult.
Connie's foot is healing so well, she started training for a marathon, and she's ready to wear high heels again. Dr. Lee advises women to only wear heels for short periods of time, not 8 to 10 hours a day. To demonstrate, he enlisted the help of OhioHealth marketing specialist Missy Gleason, who volunteered her feet and her shoes.
So, Missy, what I'm going to do with you is I'm just going to take my pen and I'm just going to draw an outline of your foot right here. And if I do that outline and ask you to step away.
Put your shoe on it?
Yeah, I'm going to ask you to step away, and then we put your shoe right on top of it. You can really see how much we're really pushing into that.
Okay, Dr. Lee made his point, and though we were laughing, his demonstration made both of us think about how we abuse our poor feet. For the most part, tiny shoes with big heels are to blame.
When we look at countries that don't wear shoes, Papua New Guinea, rural China, the overall incidence of bunion is about 6%. When you look at the United States, where of course we enjoy our fashionable shoes, the incidence of bunion in the female population is 65%. From country to country, the incidence of bunions will change. We're 65%, France and Italy, 75%. So as our shoes, our female shoes, have grown higher in the heels and more narrower to be fashionable, we do think that the incidence of bunions and hammer toes have increased with time.
While heredity does play a part in whether or not women develop bunions, the biggest culprit is high fashion shoes. The strain from shoes literally pushes our toes out of proper position.
And after a certain amount, it will be permanent, which is why we'll need a surgical correction at that point.
How do you know if you've reached that point? The pain.
Pain is probably the single biggest indicator. If you have pain at rest, if you have pain while barefoot, and if you start to develop pain at nighttime, this might be a good time to seek medical attention. Initially starts with a dull ache as they've been on their feet for a prolonged period of time. As the toe starts to deform and as the bunion or bump starts to develop, it will start to pinch some of the nerves on the inner border of the foot, and then it can become sharp and stabbing.
But you could avoid surgery altogether if you follow Dr. Lee's rules. Wear lower heels, wear shoes with wide toe boxes, and wear shoes with good arch supports. So be practical during the day, but you can pull out those Jimmy Choos for your next night out on the town. Yep, that's great advice, ladies. We all need to pay attention. The preceding portion of Daytime was sponsored by the G. William Parker, M.D. Fund for Health Education through the Grady Memorial Hospital Foundation.